Good morning. Good morning. No response? Nothing? Okay. Whew. Good morning.
Good morning.
That's a little better. Look at all these front row seats. Give me a high five.
Hi.
High five.
My idea.
Excellent. My name is Jonathan Cody. I'm the Director of Admissions here at Boston University School of Public Health. And the first thing I want to say is congratulations. You guys have worked really hard. Yes. Snaps, claps, whatever you do. Pats on the back. Excellent. The next thing I want to say is welcome. Welcome to all of our admitted applicants who have spent hours on sofas. Are you glad that's over? Yeah. Me too, although I have to look at it every day. So you've worked really hard to get here, and I also want to welcome friends, family members, partners, spouses for supporting your potential incoming students, because it takes a community to help support these academic endeavors. So welcome to you as well. We're glad you're here. We're excited that you're here. It is a beautiful spring day in Boston. I mean that. This is it. How many of you are in Boston for the first time? Ooh, all right. Who's from the area or familiar with Boston? Okay. All right, we got a good mix. Those of you from Boston, find a new friend that's from out of town and show them around a little bit. But seriously, welcome, congratulations. I want to tell you a little bit about Boston. Boston is amazing. It's a huge hub for healthcare and education, and that's why we think we're doing a great job at public health education. Welcome to Boston University, the 4th largest research university in the country with tons of resources. And welcome to BUSPH, one of the best leading public health schools in this country, which is fantastic for you and for us. We're very proud of what we do here. I want to tell you a little bit about the day before we introduce our speakers. You've heard from me many times, phone calls, emails. You're sick of hearing from me. So today is your chance really to engage with faculty, school leadership, current students, and later on some alumni at the reception. And so these are the folks that are going to best bring the story of our school to life, why we care about what we do, why we care about gun violence, why we care about structural racism and its effect on marginalized populations. What are we doing to combat that through research, education, and practice? It takes all three. And what you're going to learn today is our unique mix of those three and how we bring that to life and be a leading voice for change in public health. That's what we're here for. And so part of that is having a solid roadmap and having a plan and a vision for the future. And that is through our senior leadership team led by Dean Sandro Galea, who will be giving opening remarks this morning, as well as some of our other senior leaders as well. So I will say the day is going to be long. I recognize that. I also recognize and appreciate that this morning you're sitting in folding chairs, which may not be the most comfortable. So we'll try to recognize and stand up and take a stretch break. But really today is for you to engage with us. Ask lots of questions. Ask the same question to more than one person and see what they say. We really want you to get a good feeling of our community. We want you to get a clear sense of how you would fit here if you're here in the fall, hopefully joining us for school. But more importantly, just to get that gut feeling and that reaction of, I can see myself here, and this is what I want to be doing with my life, and that you're with other students who feel the same exact way about some of the issues that we all care about. So interact with us, engage with us. It will be a little bit of a long day, but we know many of you can only be here for one day. So what we want to do is provide ample opportunities for you to engage with different members of our community. So I want to talk a little bit about the day just to prep you before we introduce our first speaker. So I'm going to borrow this packet. Oh, your phone's in there. Oh, that's good. All right. I knew you sat in the front row for a reason. Excellent. Okay. So in your packet, you have a bunch of materials. The first thing to notice is there's a colored sticker on the front. I apologize for folks who may have vision challenges with color, but it is printed on the inside as well, just in case. So this color is important for you because this is your cohort. We're going to put you in cohorts for lunch where we separate and we're going to have meaningful discussion around climate change. And so you'll see that you'll have a specific lunchroom. Your color is also tied to if you want to have an individual financial aid appointment. This afternoon, there's certain times on the back of your agenda where you can sit down and speak with a financial aid representative. We are going to break for lunch later on. Just to prep you all, we're going to have family members, guests, spouses, friends. We're going to keep you for a separate lunch with some of our leadership, and we invite you to stay for that. After lunch, we invite you to come back and meet up with your admitted applicant at the student panel, and we'll have some guides there to show you where that's at. And then the rest of the afternoon is sort of a choose-your-own-adventure. We have a number of activities: student life and housing, professional development to talk about how we approach the career search from finding a practicum, internships, through career search for life. And then there's going to be some additional tours in the afternoon. We close out the whole day with a reception back up here at the end of the day, and I would invite you to bring any outstanding questions back to us. We'll connect you with a faculty member and alumni to kind of wrap up the day. So I hope you can stay for the whole day. It's going to be exciting. It's going to be fun. And we want you to stay. So the last thing I am told to tell you is that some of you left bags down in the lobby on the first floor. And just so you know, we brought them up in the booth, in the coat racks up here, just so that there's eyes on them and they're not left in the lobby. So that's it. All right. You can have this back. Thank you. And without further ado, I'd like to bring up our first speaker for the morning, our leader. We had talked about having a clear leadership plan, and that's headed by Dean Sandro Galea. So welcome.
Good morning, everybody. I'm Sandro. I have the great privilege of being Dean of the School of Public Health. So welcome. Welcome, everybody. Really, I just want to say a few words about who we are as a school and why we do what we do. And I'm going to start with a question. So how many of you have heard of Carl Sagan? Raise your hand if you heard of Carl Sagan. Okay, so Carl Sagan was an astronomer who became quite famous, got a lot of TV shows. And one of the little known things about Carl Sagan is that he was actually quite involved with the space program. And in 1977, the spacecraft Voyager, people heard of Voyager? It was a spacecraft that NASA put together and sort of went out in space. And the idea was it was going to keep going. It's never going to come back. And that's exactly what's happened. So it's out there somewhere. And Carl Sagan was responsible for creating the content of the Voyager in case it meets aliens and they need to sort of figure out about us. And one of the things that was on there was a CD. Now this is 1977, so it's actually the early days of CD, like before CDs became mass market, and before then they went away for streaming. And it was actually a gold-plated CD. You can actually Google this and find a picture of it. Not now. After I finish talking, you can actually Google it. And on that CD are sounds of humans. So the idea was if aliens find it, they will hear sounds of the Earth. And on there is a song. And the song that Carl Sagan chose is called Dark Was the Night. And there are no words in Dark Was the Night. It's a blues song, and it was recorded by Willie Johnson. Now, Willie Johnson was a bluesman who was born in Texas at the turn of the 20th century. He was born in Texas. When he was 7, he was blinded in a domestic violence incident when his mother threw lye in his face. So we actually know him as Blind Willie Johnson. So he grew up in Texas. He was poor, black, blind. He learned how to play the guitar, and that's why we remember him. That's hence the story. As you can imagine, learning how to play the blues and busking, which is what he did, is not a very lucrative living. He got married. He was living in a small hut and with his wife, and their house burned down. But they had no money, so they kept living in the shell of their house. When he was early 40s, Blind Willie Johnson got malaria. So now we're dealing with this is like the 1940s in Texas. His wife took him to hospital, and he was turned back from the hospital. He's turned away. Now, it's not clear if he was turned away because he was poor, because he was blind, because he was black. And then he died. So the question, and the reason I'm telling the story is, the question is, well, what killed blind Willie Johnson? Well, what killed him was malaria, right? Like the physiologic process that killed him was his malaria, that had he had pills for his malaria, or a shot or something, he would have lived. He would have lived that day. But everybody knows that something else was going to get blind Willie Johnson. If it wasn't malaria that day, it was going to be pneumonia the next day. If it wasn't pneumonia the next day, it was going to be injury the day after. Because what killed blind Willie Johnson wasn't just malaria. It was malaria, it was homelessness, it was poverty, it was racism, it was domestic violence, and it was poor access to care. All of those forces killed blind Willie Johnson. Now, I'm telling you this story because that is what public health is about, and that's what we should be doing in public health. We should be interested in the full range of forces that create health in populations. Now, that means malaria. I just want to be clear. Malaria is very much something that we should care about. But so is poverty, and so is homelessness, so is racism, so is access to care. And in many ways, that is what makes what we do so interesting and also so difficult, right? It is a large expanse. And sometimes I get, well, does that mean you're doing everything? Well, no one of us can do everything, but surely all of us together can. And that is how the school was founded. That is very much the DNA of the school. So this school was founded initially by a group of physicians who will emerge from the medical school, as with many schools of public health. Essentially, nearly, probably every single school of public health emerged this way, who said, medicine is just one small part of generating health. And we want to understand the full range of forces that generate health. This is a school that went through its first, it's now in middle age, through its first formative years, really articulating for itself a vision of public health grounded in social justice and grounded in a deep appreciation for us caring about not just malaria, but also homelessness, domestic violence, poverty, and racism. And what's interesting about the school is that in doing that, in articulating that as its core vision from the very beginning, it also had the dual part of its vision of saying it wants to care deeply about teaching and about students, and it wants to care about being part of the world. So fast forward to now. In the past few years, the school has done a strategic thinking exercise, which has come up with a core purpose, which you've seen all around, which is this think, teach, do idea. Think, teach, do for the health of all, and you've seen it around. And that is actually very intentional, because the school sees itself as generating knowledge, teaching that to students, and being a part of the world of action at the local, municipal, state, federal, and global level. And then with intentionality for the health of all, which means that we care as much about creating healthy populations as much as we care about making sure that all populations come along. Now, we don't have the hubris to think that we today, those of us who are in faculty, staff in the school, are going to change the whole world. No, that's why you're here. Our goal is to do our bit and train you to do your bit. And then we hope you'll pay it forward by training people who come after you to do their bit. And that's how we see the school. We do scholarship, we do education, and we do practice. And that's why you're going to be hearing from the associate deans about that. That's the balance we strike. I'm going to tell you one last story, and then I'm going to step aside because the associate deans have the content, and they'll discuss all this with you. 36,000 people die from guns every year in this country. I want to be very clear. I realize this is a controversial issue, and this is not a partisan comment. I am just coming at it from the place of health. It is incontrovertible. 36,000 people died from guns. How many of you saw the Boston Globe on yesterday? Did you see the gun spread in Boston Globe yesterday? So the Boston Globe had an amazing gun spread yesterday, and they did a very simple calculation. They said, what will happen if every state in the union followed Massachusetts' example? Massachusetts has the lowest rate of gun deaths in the country. That would save 27,000 lives a year. And their spread was actually called 27,000 lives. Now, this is an issue from hell. This is knotted up in politics, in ideology. It has been intransigent for decades and decades. So the question we asked ourselves as a school was, what can we do about it? Going back to the think, teach, do, right? Well, what can we do about it? Number one, on the think side, we have faculty who do research on guns. If you look at the Boston Globe spread and you look at the little fine print at the bottom, you'll see that a bunch of their data comes from work that's done at the school that Professor Mike Siegel and his team have done that have created really the best database there is about gun violence and gun injury. So that's our think side. On our teach side, we have courses around firearms, and we have an engagement, a number of events and programming that's on a regular basis so that our student community can engage with learning what they need to learn about guns. In fact, we just had an amazing event which was organized by Dean Harold Cox, who is, I just saw right now, lurking outside the door, where we actually had a panel for students, and then we engaged the students in actually calling their representatives around guns. So it's the teach shifting to the do. And then I just want to tell you one last do story on this. So in November of 2016, the week after the election, we called a meeting of all the schools and programs of public health to say, what should public health do about this issue? Now, when you call a meeting of all the schools and programs of public health, you organize it 6 months in advance. So when we arranged the meeting, we, like everybody else in the planet, thought there was going to be a different president, which would open up opportunity for work on guns. And again, this is a nonpartisan comment. I'm just stating the facts, okay? I mean, does anybody disagree that everybody on the planet thought there's going to be different presidents? No, it's been, the current president himself did not think he's going to be president, so it's fine. I mean, he said as much. So, we arranged the meeting. The meeting happened a week after the election. You have all of these program directors of public health in this room, right? And they're all here talking about guns. And what do you think was the mood? The mood was, we're never going to achieve anything about this. We had the meeting, and the ethos was, we, as academic public health, have a responsibility to do something, to speak truth about this issue. Had the meeting, a consensus document emerged, which was called the Call to Action. That was published in the American Journal of Public Health. Now, this is in 2016. Since then, we've had tragedy after tragedy on guns, again, which was the same as we had before. But, you know, the tides are shifting. Momentum is shifting. Last week, about 10 days ago, 26 senators sent a letter to the Senate Health Committee saying it is critical that we lift the ban on research on guns so that at least we can inform the public conversation. And that letter, in the second paragraph, it says, because in November of 2016, there was a gathering of the schools and programs of public health, and they came up with a call to action, and their #1 recommendation was that we lift the ban on research. And in the omnibus bill, spending bill that just came through Congress, there is in it language to lift the ban on research. Now, this was not just something we did by ourselves. This is, we are part of an ecology of action on this issue, which I called an issue from hell. And slowly, slowly, the country will actually grapple with this. But I'm bringing this up to give you a sense of the kind of school we are building and the kind of school that you can be part of. It is a school that first and foremost, leads with excellence in research. First and foremost, we're about data. We're about generating data. We are about making sure our students learn the best possible science and the best possible way to act, but making sure that our data and our teaching happen with passion and purpose, and that is part of the world of action. That's think, teach, do for the health of all. My professional life has been in academic public health. I actually think this is an interesting, worthwhile way to spend a life. I think it's a mission-driven life that is, frankly, gets me out of bed in the morning. And one of the joys of that is being around students who are actually beginning their journey. So thank you. Thank you all for being here. Good luck with your next steps. Unfortunately, I can't be with you because I have to go to the president's house for another event, which has nothing to do with any of this. But that's actually part of my professional responsibility. So it is. That's actually where I came from right now. But I told them I'm ducking out for an hour to come here, and then I'm going to go back there. But whatever you choose, whatever you decide to do, good luck on the next steps in your journey. I actually think, I'm sure this is an unnerving time. You're making decisions, et cetera, et cetera, et cetera. But you know, whatever you decide is all going to be fine. Whatever you decide is going to be fine. It's an exciting next phase of your life. And good luck. You can find my email online. I'm very Googleable. If anybody has any questions, feel free to send me an email anytime. I answer all my emails. My emails are mine alone. Thank you for being here. Have a great day.
Thank you, Dean Galea. Next, I'd like to welcome up Professor and Dr. Lisa Sullivan, who's Associate Dean for Education, also a professor in the Department of Biostatistics, to talk to you about our educational program. Lisa.
Thank you. Welcome, everybody. Good morning. So you heard what we do. I'm going to start to tell you how we do it. So I'm going to tell you about our educational program. I'd first like to congratulate all of you. As Jonathan said, we sift through thousands of applications every year. And you are identified by our faculty as the best and the brightest, those with the greatest potential to make a difference in public health. So congratulations to all of you. So let me tell you about education here at the school. So our goal in education is to provide you with the knowledge, skills, and professional confidence to practice public health. The approach is to first give you a strong foundation in the knowledge and skills for 21st century public health professionals, and then we allow you to choose the specialization that most fits your interests and professional goals that are targeted to the needs of the field. We also have lots of opportunities for you to develop professionally and to get professional and practical experience while you're here. You are in the right place at the right time. The healthcare sector is expected to be the largest source of job growth. The Association of Schools and Programs of Public Health estimates needing another 250,000 public health workers by 2020, which is when you'll be out and entering the field. There are shortages of public health workers in lots of areas, and I'll show you in a minute where our graduates go in the field. So as Dean Galea said, our approach to education is actually built on three things: education, research, and practice. We don't do any of these in isolation. We have faculty who are committed to teaching, who are also engaged in research and committed to service and activism. Let me tell you about a project that I've been involved with. I happen to teach the Biostatistics Quantitative Methods course here at the school, but I have had the privilege to be involved in the Framingham Heart Study, working on a research team. Has anybody heard of that study? So this is one of the world's largest cardiovascular studies. It was actually started in 1948 in the town of Framingham, which is about 20 miles west of here. About 5,000 people were enrolled in the study, and at the time, there was an epidemic of cardiovascular disease, and no one knew what was causing what seemed to be an epidemic of cardiovascular disease that had never been seen before. So the town of Framingham was selected as a typical United States town where investigators could try to understand what the risk factors for cardiovascular disease might be. And so the study started almost 70 years ago now. It's still going on today. In the mid-1970s, a second generation was enrolled, and in the early 2000s, a third generation was enrolled. About every 4 years, those participants in the original cohort, the second generation, and the third generation have been followed and analyzed. Now, why do you think we need multiple generations of data? There's enough data that would fill this room 10 times over. Why would we need multiple generations, do you think? The environment keeps changing. What can we learn from people who are related? Genetics. So that is a big part of understanding disease. So this study is one of the first to involve multiple generations in study. And this picture is the front of the webpage of the Framingham study, and the gentleman in the middle was in the original cohort. The person to his left is his son in the offspring or second generation, and the person to his right is the grandson. And these people, as many families involved in this study, are so extremely committed to this project. I've been involved in a small piece of it. It's actually a huge study. Much of what we know about cardiovascular disease today actually was discovered in this study. Many of us here at Boston University work on this study. And I've been involved in a small piece developing what we call risk functions for cardiovascular disease. These are mathematical equations that predict the likelihood that a person might develop cardiovascular disease, say in 5 years or 10 years, based on what we know about them today, based on their risk factors today. And I'm bringing this up because this is the kind of research I'm involved in. I can bring this into the classroom. Our faculty here don't do research to talk to one another in scientific meetings. We do research that actually makes a difference for people. We do research to engage our students in thinking about how can we translate these findings to the field. That screenshot on the right is a screenshot of an app that has taken a risk function and put it in the form of an app that people can use to actually find out what is their likelihood of developing cardiovascular disease. So over there on the right, the person who's entered data is a male who's between the ages of 40 and 44. His total cholesterol is between 200 and 239. His HDL cholesterol, which is the good cholesterol, is between 35 and 39. His blood pressure is between 140 and 149. He's not on blood pressure lowering medications. He does smoke and he doesn't have diabetes. Based on that profile, his likelihood or probability of developing cardiovascular disease in the next 10 years is 18%. So we develop these equations and we spit out these percentages. Some people have a difficult time understanding what does that mean? Is that a high number or a low number? The next number is this person's heart age. This was a concept that was developed in Framingham, and the idea is to try to help people understand what that means. Based on that predicted probability, this looks like a person who's 68 years of age. Is this a good thing for this person to see when they open this app? Why not? Because this person is actually what? In their low 40s. You don't want to have the heart of a 68-year-old if you're in your 40s, right? You want to see that to be less than 40, ideally. So this was a way that the investigators attempted to try to translate that information. Again, we do the research to engage with our students, to get it out there to make a difference. That's why we're doing this work, and this is just an example of what I might bring into my class and talk to students about how do we get this out there in a way that makes sense. So back to nuts and bolts. So we have a number of graduate programs here at the school. Our largest program is the Masters of Public Health. It's a 48-credit program. It gives you broad exposure to public health, all of the things that Dean Galea was talking about, the opportunity to specialize in areas that are of interest to you, and then opportunities for training and professional practice. So many of you are here today to talk about the MPH, and I'm going to focus on that, but I just want to tell you about the other programs very briefly. We also have a number of Master of Science programs. These are in specific areas. They are 32-credit programs. The idea is they sort of skip that broad foundation, and they go very deeply into a particular area. We also have graduate certificates. These are often of interest to people who have other graduate degrees who might want to come back, an engineer, a lawyer, to understand what is public health all about. And they can do a graduate certificate in public health. We also have certificates in statistical genetics and biostatistics in clinical trials. We have a number of doctoral degrees, PhDs, and DRPHs. What I want to focus on today, though, is our Masters of Public Health. So it's based on 3 components: the foundation, the specialization options, those are for you to choose, and then the professional development and practical experience piece. So the foundational piece is what we call our integrated core. All of you in the MPH will take these 4 courses: quantitative methods for public health, individual, community, and population health, health systems law and policy, and then leadership and management for public health. These will give you a broad foundation in all of the areas of public health, and all of you will take them together. The way we organize everybody going through this integrated core is we put our students into cohorts. We are a large school. We will take 400 students coming in the fall, and they are 400 highly selected students. We organize people usually into cohorts of about 75 to 80. So you'll be with that same group through all 4 of the core courses. Full-time students will take all 4 at once. Part-time students, we recommend to take the quantitative methods and the individual, community, and population health first. And people can take 1 or 2 courses at a time as you go part-time if you're interested, and that's up to you. So this is just to give you an idea of what the schedule might look like. So our courses meet once per week for 3 hours, and they either meet 10 to 1, 2 to 5, or 6 to 9. We offer courses in the evening, which are generally of interest to our part-time students or people who might be working some part-time. That helps with that. So in addition to taking the 4 courses, you also have a lab. That's where we integrate and pull all of these things together, talk about cases and applications that bring all of the concepts together. Then each of you will choose your certificates. These are the areas of specialization that are of interest to you. So each of you will choose what we call a functional certificate, and then you have the option to add a context certificate. You can choose a functional and a context, or you can say, I just want to do the functional and then build out the rest of my program with electives. That's totally fine. It depends on what your interests and professional goals are, and we can help you to determine what program might be best for you to prepare you for your professional goals. So these are the list of options of functional certificates, and many of you have already chosen what you're interested in. Some of you maybe are in between things, and we're certainly here to help you today. And as you go through, you are deciding on coming to BU and getting set up to make the best decision possible. So these are all the options that are open to you in terms of functional certificates. This afternoon, you'll get to meet with faculty and staff and students who have been through and who are running these certificates and can give you more detail. These are the context certificates. So lots of our students choose a functional and a context to pair particular skills training with an area of interest or application. And so you can choose one of these if you're interested. Again, if you really want to focus on the functional and you want to go more deeply into that area, that's totally fine. You can do that. Just to give you a sense of where our current students are, so the most popular functional certificate is epidemiology and biostatistics, of course. That's because I'm a biostatistician, that's why I say that. The second most popular is, we abbreviate it CAPTE, Community Assessment, Program Design, Intervention, and Evaluation. We struggled with that name, but it pretty much tells you what it's about. We actually did a survey of the students, is there a better name? And to our faculty's displeasure, the students like that name. So we stuck with it. Policy and law, health communication, and so forth. So these are just how our current students have arranged themselves. And again, you choose whatever is best for you. And then these are the context certificates that people have chosen to match with those functional. Global health is very important, maternal and child health, infectious disease, chronic disease, and so forth. The third piece of our program is what we call professional development and practical experience. So all of you will do a practicum. So this is a 240-hour, like an internship. So you will go into an organization, a public health organization here in Boston, around the United States, around the globe. And there are funding opportunities to support you in these things. Many of these opportunities are paid. All of you will do what we call a career prep program. This is a required program run by our career services professionals to make sure you understand how to market yourself, build networks, do a 30-second elevator pitch, get your resume and your cover letter in order, negotiate job offers. And this is a very important thing. At this school, we make a lifelong commitment to our students in career services. So as a student of this school, you have access to our team of career services professionals for life. And unlike many of us who chose a job, a career, and we stay in it forever, that's not what you people tend to do. You take a job and then you take another one and another one and another one. Well, our career services professionals are here to help you. And they often have current students in the office, as well as young alumni, as well as alums from, that have graduated decades before. So this is something we're very proud of, and we want to make sure you understand this when you understand the details of our program. All of you also will do what we call an integrative learning experience. This is tied to your functional and context certificates, and it's essentially a work product that you do to bring together everything you've learned in the program. And the nature of it depends on the particular certificate combination you have chosen. So for example, if you choose Epi and Biostats, you do a data analysis project. If you choose health communication, you put together a public service announcement or something of that nature. The idea is you come away from the program with a work product that you can then take to an employer and say, this is what I can do. And you can demonstrate to somebody the kind of thing that you are able to do based on your program. Let me go back to the practicum. I failed to mention one thing. Our Career Services Office is actually Career Services and Practicum Office. We have staff who can help you identify these opportunities. Some people say, where am I going to find such a thing? We actually have hundreds of opportunities. We have links with employers here in Boston, around the country, and around the globe. So we help people to identify what might be best for them. It's not left to you to do so. You can customize your program. You are allowed to study here full-time or part-time. Our students often cycle back and forth, depending on what's happening. Lots of times people come in and start full-time, then they get engaged in a research project, or they pick up a little part-time work that might be helping them financially or with their program, and you can shift to part-time and back and forth. That's totally fine. You have the option to choose your certificates and electives, but throughout the program, there really is a focus on practical application, building your skills and confidence. We have lots of advising supports here to help you in deciding what's the best course of action and in supporting you to be successful. We have professional staff advisors, and those include people in our Career Services Office, our Graduate Student Life, and so on. Each of you is assigned a faculty advisor in your area of interest. The Career Services professionals, I mentioned the kinds of activities they help with practicum and employment. We also have an alumni mentoring program. If you're interested, we match you with an alum, and that person can provide you different kinds of advice. They're not going to be talking about the nuts and bolts of the program necessarily, but can help you in negotiating the field once you get out. We have here what we call an open door policy. Jonathan already mentioned this. The goal for you for today should be to get every single question you have about this program answered. We are all here today to answer those questions, and we continue with that openness as faculty and staff at this school. What we mean by open door policy is even though you're assigned a faculty advisor, every faculty in this school is accessible to you. You can make an appointment, you can talk to any faculty or staff member in this school, and that is just the culture of the school. Our Office of Graduate Student Life has lots of resources both for academic and professional growth. We have a peer coaching program. These are students who are a little further along who serve as peer coaches and mentors. They help you in writing assignments and other things. We have a writing and presentation center. You can go and show somebody, I'm working on this assignment, and they can give you some advice in tuning it up, or you can run through a presentation and get some feedback. We also offer conference travel grants. Our students are very active in professional organizations, and we encourage this, and we provide some support for you to go out and make presentations at professional meetings if you're interested in doing that. Just to give you a feel for our students, about a quarter come directly from undergraduate programs. The average age is 25 years, but there's a wide range from 21 to 63 years. About 10% have other graduate degrees, MDs, PhDs, nursing, pharm, and so forth. Lots have experience, about 2 years on average. 70% of our students work part-time at some point. As I said, a lot of people come in initially full-time and then shift. About half are involved in research projects at some point while they're here, and about half belong to professional organizations. Our students come from all over the globe and all over the country. We haven't quite figured out what's happening in the upper Midwest, but we're working on it. Our graduates are highly sought after by recruiters and employers. They're highly satisfied with their training, and this number is for the parents and friends. 92% of our students are employed within 6 months. And that is a number we're very proud of because we work really hard to prepare you with relevant skills, and we have career services staff who can help you go out and get the best job offers possible. Our students work in all kinds of industries and in all kinds of functions. I realize these are small, but these slides are also available. I encourage you to look at our career services website to see the nature of the support that's offered there and where our students are going. I will be around the entire day. I'm here all day at the reception, so if anyone has any questions, I'd be very happy to answer them. Thank you again for coming for the day. Congratulations again, and I hope to meet each and every one of you through the course of the day. Thank you.
Thank you, Dean Sullivan. Next, I'd like to welcome Professor and Associate Dean Michael McLean, Associate Dean for Research, and also a professor in the Department of Environmental Health, to talk a little bit about research.
Great, thanks. Good morning, and welcome everyone to Boston University. So, like Jonathan mentioned, I'm a professor in environmental health, and I oversee research here at the school. And you know, I understand that, you know, given your interest in the MPH program, your plans to enroll in MPH, you know, your research may not be your highest priority. It may not be something that you're looking to engage in. Maybe you're not yourself looking to become a researcher. But my goal today is really to give you a sense of the research we do at the school, to provide a backdrop for what your educational experience will be. It gives you a sense of who we are and what we focus on, and also how it will impact your experience here as a student. Even if engaging in research isn't something specific that you plan to do, I think you're still going to benefit from all of the research that we do here at the school. And so I want to start by putting our research into context. I think you've already heard a couple times this morning that we're not just doing research for other researchers or for other scientists. You know, it is true. We publish our work in journals. We go to conferences. It's important to share and disseminate our work. But we are focused on research questions that solve real-world problems. So we're not just interested in sort of esoteric, interesting questions to ask because we can ask them. We're trying to identify real-world problems and designing research studies that then get at solutions to those problems. And so this is sort of getting at how our think, teach, do elements of our core purpose are integrated. They're really not as siloed as those periods, you know, after each one might suggest, right? It's really well integrated. And so we're solving real-world problems, and that means also that in the classroom, your instructors, most of them are also engaging in active research. So that means that in the classroom, you're learning cutting-edge methods that are being used out in the field. You're hearing about research that's hot off the presses or in progress or being planned by, you know, being conducted by the people that you're hearing from directly. And it also means that outside the classroom, if you choose to, there is plenty of opportunity to engage in different steps of the research process. And so, you know, one of the things you may have picked up on is, you know, my colleague over here, Dean Sullivan, oversees education at the school, but she's also very much engaged in research. I oversee research at the school, and I'm very much engaged in teaching. I've designed and teach my own course. I mentor doctoral students. I oversee a couple of training programs. And most of the faculty at the school have a similar mix of activities across many different domains. So just as a quick snapshot of our portfolio, we have about $50 million a year in research funding. Most of those projects are across multiple years, so the total portfolio across multiple years is more like $180 million. The majority of our funding is from government sources, although we also have funding from a lot of large foundations like Robert Wood Johnson, Gates, you know, many that you'd be aware of. Now, not to worry, I'm not going to try to summarize our $180 million portfolio here this morning. I just want to give you kind of a sense, a flavor of what we do here. And so in that spirit, I want to give you a sample of resources. One of the great benefits I see of, you know, our school and our environment is that our school can be small when you want it to be, but our environment can be big when you need it to be. You know, you can be working with your individual advisor, with your individual instructors, working within a particular department, in your concentration, you know, within your certificates, within the school. But then when you need the broader, extensive resources of a large research university, it's there for you. And, you know, and at different times, we want different sizes to be available to us. And so just as an example, you already heard a little bit about the Framingham Heart Study. Over 15,000 participants. In fact, just the term risk factor actually came out of the Framingham Heart Study. That's the significant role it's played in epidemiologic research. As another example, we have the Black Women's Health Study. Almost 60,000 black women were recruited about 20 years ago. They're followed at about every 2 years, and that population's been used to study diabetes, breast cancer, blood pressure, many different health outcomes. And then I'm part of our Superfund research program, which is, it's really based in the Department of Environmental Health, where we study the health impacts of the types of exposures that can occur from hazardous waste sites. And that's a program that's been in place for over 20 years now and has many different projects and a training component, community engagement component, so that we're not only conducting research, but we're also engaging with the affected communities, and then we're translating that research for policymakers in a way that it's actually going to make a difference in the real world. Now, I was trying to come up with some way I could give you a sense of our research portfolio without droning on too long, so I thought I would give you the headlines. And in this case, I'll give you the actual headlines. For me, I think one of the really cool things is when you're a student at a school and you might be commuting on your way to class and you see some cool article in the New York Times, and then you head into class with one of the researchers on that study who can tell you about it firsthand. And that's still exciting for me, too, when I'm on my way to work and I see some cool headlines and I'm like, oh, that's us. That's really cool, right? So here's a recent headline from Reuters, where after the election there was a lot of conversation about how socioeconomic factors played a role in the surprise result. And Professor Bohr in the Department of Global Health looked at different counties in terms of life expectancy. And we all know that on average, life expectancy has been increasing, but that's not true everywhere. Some counties, life expectancy has been increasing. There are other counties where life expectancy has either has been increasing less or actually in some cases declining. So he categorized counties into those two groups, and he found that in places where life expectancy has been increasing, those counties tended to vote for Clinton, and in places where it was holding steady or decreasing, those counties tended to vote for Trump. And in a way, that's not surprising, but when we're thinking about health, and life expectancy, you can start to feel how, what those communities or what those counties what may have been impacting their decision, feeling like something needs to change, right? So from the Washington Post, here's another headline from Professor Sebastiani in the Department of Biostatistics. She looked at thousands of volunteers and many different biomarkers to try and figure out which biomarkers or clusters of biomarkers might predict long-term health. And using all kinds of fancy whiz-bang biostatistical methods that I cannot describe for you, she grouped these clusters of participants based on how their biomarkers kind of group together, how they trend together. And she found one particular cluster that, based on their biomarker results, were much healthier than average with a lower incidence of disease and early death. And the reason we do biomarker research is you can start to think, well, what if a drop of blood, what if we could get so good in our diagnostics that just even a drop of blood could give us all sorts of diagnostic capabilities in terms of projecting someone's long-term health or identifying what diseases they might be at risk of. And then that helps to inform what the appropriate intervention should be. And so that's some work coming out of biostatistics, of course. This is actually one of those cases where I was on my way to work and I saw this headline and read it and then realized, oh, that's us. You heard from Dean Galea, the gun violence. Bringing gun violence to the forefront as a public health issue has been something our community is really focused on. In this particular case, they were looking at the gun manufacturing data and found that from 2005 to 2013, about an 8-year period, the amount of guns manufactured in the United States increased from 3 million to 10 million. And that's a pretty big increase in a fairly short period of time. And what they found, what they were trying to get at is, well, why? What is accounting for this increased demand of guns? And it's not because there's a sudden spike in skeet shooting interest, that it's being motivated, by fear and a desire for more self-defense. Which is important to understand and concerning. And then finally, this is my last example. Sometimes it happens with some of my own work. I'm part of the research group here that's involved in looking at concussions and the long-term neurological consequences of head impacts. You may have seen this headline. It got a lot of coverage from some work we did where we looked at 111 former NFL players and found that almost all of them had signs of chronic traumatic encephalopathy. And this is a lot of work that you've probably heard about from our group. It's received a lot of attention, which can sometimes be a little unnerving when you know that every time you're going to be putting some new piece of work out there, it's going to undergo a lot of scrutiny. My most memorable case of seeing some of our own work appear in the media was a different study we published where we were looking at the long-term cognitive function of former NFL players depending on whether they started playing football before the age of 12 or after the age of 12. And in a way, that's not a especially elegant study, right? I mean, that's pretty straightforward. But the reason we wanted to ask that question is because that's what parents want to know, right? That gets directly at the public health question. That's what people want to know. So we want to provide that answer. And it turns out, if you started, for the football players that started before the age of 12, they had much worse cognitive function than players who started after the age of 12. And 12 is an important age in terms of brain development. And so that was the basis for us asking that question. But back to it appearing in the media, there was a Sunday morning when I came downstairs, I got my coffee, I flopped down in front of the TV, I was planning to turn on ESPN to get SportsCenter, and Outside the Lines was on. And Outside the Lines is like, it's basically 60 minutes for sports, right? And so Outside the Lines is on, and there, scrolling across the screen, is my name. And I was like, okay, so what happens then is I threw up in my mouth a little bit. And then the second thing I did was I'm like, honey, I'm on ESPN. And given that I'm an environmental health scientist, that is probably the only time in my life I'll be able to call my wife into the room because I'm on ESPN. But, I think, like, one of the things that always strikes me when we're fretting about every last detail that goes into a paper that we know is going to get a lot of attention is that's why we're doing it. It's because when the stakes are high, work is controversial and people pay attention, and that means it's impactful. If it wasn't controversial, if it wasn't showing up in the media, then we'd have to question, are we really studying the right things? Right? So even though sometimes it raises my blood pressure, knowing that things are going to get a lot of attention, it should, right? We should be focusing on the things that are getting a lot of attention. Otherwise, you just got to start to wonder, maybe we're not studying the right things. It means the stakes are high. So what does all of this mean for you? It means that in the classroom, you're going to be learning cutting-edge methods directly from the people that are using those methods on work in the field. There's plenty of opportunities to engage in research with faculty if that's something you choose to do. It's not necessarily a requirement, but if you want to, there's plenty of opportunity. You can engage in any step of the process, from submitting, preparing and submitting a grant application, actually conducting the project, presenting it at a conference, writing up a manuscript, and then, of course, developing an understanding for how that research then gets translated into practice to make sure that it doesn't just end at the conference or end at the paper, but what are we actually going to do with those results to make sure that it has an impact afterwards? So how can you get involved if you want to? Your advisor is, of course, a great first point of contact, but as Lisa mentioned, you can go to any faculty member, and I guarantee you one thing professors are always happy to do is talk about their research. They'll say, well, yes, that's exactly what I want to talk about. Please, come right in. So you can always reach out directly to people and say, I'm interested in the work you're doing. Can we plan a time to talk? And they will be delighted. You may have to cut the meeting short. This has been really interesting, but I got to go. Enough. If you're interested, to learn more about practicum opportunities, internships, fellowships, we have systems in place to make that as easy as possible. We have SPH Handshake and career services. You can think of those essentially as like for SPH Handshake, it's sort of like a Match.com. To figure out what are the opportunities, what are your interests. We'll try and make matches. But then, career services is more like the Monster.com. You're going to go out in the world and try and find opportunities. And then, of course, there's the BU Human Resources website. There are routinely actual, employment opportunities to be research assistants, to actually have part-time or full-time jobs working on research. And the university does have a really wonderful tuition benefit if you choose to become a full-time employee working on research and then maybe become a part-time student. There is a great tuition benefit for BU employees. So there's the BU website keeps a comprehensive listing of all of the posted positions. So I'm very easy to find. You're welcome to reach out to me directly. If we don't have a chance to talk today, feel free to reach out. I'm happy to talk to you about opportunities, talk about your interests, and welcome again. Congratulations.
All right, I'd like to welcome up our Assistant Dean for Development and Alumni Relations to talk a little bit about our alumni community, Jacoba Van Houten.
Thank you very much, Jonathan, and welcome to Boston University on behalf of Boston University's Alumni Association. So as Jonathan mentioned, my name is Jacoba Van Houten, and I am the Assistant Dean of Development and Alumni Relations here at the School of Public Health, and I myself am actually a graduate of Boston University. So we are part of a global association, a global network that reaches over 10,000 alumni for the School of Public Health specifically. We represent 114 countries with our alumni, so we're reaching far and wide. As Lisa mentioned, 92% of our alum are employed within the first 6 months, and our highest concentration of alumni really live in Washington, New York, San Francisco, and Boston. But again, we represent 114 countries, and we have associations built across the globe, and I'll show you that in a moment here. So here's the Boston University Alumni Association. So you see every red dot there is actually a location where we have an alumni association, alumni council set up. So this acts as a resource across the country and across the globe for current students, prospective students, peers, and alumni to reach out depending on where they're looking for jobs, depending on where they're looking for practicum opportunities, internships, and where they're looking to move. So we have access to go in and drop into those different communities and really have that significant resource. So that is something very special and specific to Boston University being such a large institution. So again, here's the 114 countries that we represent. Is anyone here from Greenland? We're looking to fill in that state by the end of this weekend, so let me know. I put this up here because this is our alumni leadership. So as I mentioned, Boston University Association, we reach the span of the globe, but here specifically we're looking to build by region across the United States. So we have an alumni leadership council that is representative of 33 alumni of the School of Public Health. And we've really built up these cohorts across the country. And what we do is we host events, receptions, focus groups, surveys, a number of activities throughout the year, again, for prospective students, current students, and alumni and faculty to network over the course of an annual basis. And again, you can see a majority of our alum are based on the East Coast, but it's continuing to grow throughout the country and across the globe. So what does it look like for alum to interact with one another? What does it look like for students to interact with other alum and, again, faculty and staff? So what we've started doing about 3 years ago is we started hosting these Think, Teach, Do receptions across the country and really across the globe. Just this past 6 months, we've had events with Boston University Alumni Association and with Boston University School of Public Health in places like Brazil, Singapore, India, we'll be going to Thailand, we'll be going to Hong Kong. So far and wide, we are hosting these receptions for alumni to meet each other. I'm finding when I go to a city, many alum don't even know that they have a network of 120 people that they could access. So I'm there to help introduce and help facilitate those interactions. So we have many signature programs actually happening here, right here in this room on campus, about 25 to 30 events a year. And what we're doing with those is we're bringing experts and alum back to campus to talk about important public health concerns and public health issues and really elevating the conversation. That's really our job as public health professionals is to talk about the issues that matter and bring our mission to the forefront and talk about how we're promoting human rights, how we're promoting social justice, how we're promoting equity. So we're bringing all this programming back here, right here in our backyard. We also have a lifelong learning. It's called PHX. It's very interesting. We've launched this in the last year. It's allowing our alumni to come back and take courses, not only in the summer, but in the winter as well. And many alum are actually coming back to teach these courses. So that's another significant opportunity for our alum. Alum will be back on campus this afternoon during the reception. We have an alum speaking today. We have alums coming back to be presenters within classrooms. So there's a number of opportunities for our alumni. And again, as Lisa mentioned, we have a very robust career services, so our Alumni Association works very closely with career services to introduce and unlock potential opportunities across the globe where our alumni work and live. We might not have access to some of those corporations, some of those internships, but we do now that we have alum that are helping, again, unlock those doors. STAMP is another Match.com type of system, type of platform. What that is it allows our students to link up to alum based on their interest, and that's a new program that is up and running and exciting. And in terms of the Alumni Leadership Council, this is where we're looking for leaders. And many of these alumni leadership members, what they're really focused in on is raising funding to help with scholarship and to help with some of our student body activities. So our alum are great leaders and a great resource for current and prospective students. So we've heard from our alum over the years, and they really want to know what's happening here at the school in terms of scholarship, in terms of research, in terms of the practice, being undergone here at the school. So we've created this alumni newsletter just for our alumni, and we have a lot of alumni writing in of what they'd like to hear from us. They want to be updated on research, upcoming programmings, upcoming activities that students are up to. So this is on a monthly basis, and we look forward, and if anyone's interested in actually signing up to see what this looks like, please visit me this evening at the reception, and I can get you on some of our newsletters. So again, we have a very robust network with the Alumni Association, so we are on social media, and we have alumni interacting and keeping updated on things that are happening in their local communities. And so just kind of an example of some of the activities that have been underway in the past year here. And again, I go back to these alumni networking receptions because we're hosting them across the country and across the globe. And coming up, we'll have one here in Boston in May. If you happen to be in the area, we welcome you to attend that. We'll also be hosting one coming up in May in Geneva that's aligning with the World Health Organization Health Assembly. So again, we're trying to have that opportunity for our alumni to network with different organizations such as the CDC and WHO. And again, here's just an example of some of the signature programming we have here on campus. 3 events that are upcoming. One about the Trump administration and the health of the public, about climate change, and another one about teaching public health. So again, we encourage parents, friends of the school, current students, and alumni to attend and take part. So, biggest event of the hour is hearing from one of our alum here at the School of Public Health. So it is my pleasure to announce Rachel Parker. She graduated in 2017 with a Master's of Public Health degree in Concentration in Biostatistics. She currently works as a data analyst at Maverick, U.S. Department of Veteran Affairs, where she performs data programming, data extraction, and statistical analysis aimed at improving the health of veterans. So before I bring her up to speak with all of you about her experience here at the School of Public Health, I just want to again congratulate you all and welcome you to Boston University. Rachel?
Hello, everyone. So I just want to first start off by saying I love BU. I know that sounds really cliche, but really I love this place. I love this place so much that I still TA a class 2 years later while working full-time in my career. My friends think it's crazy when I tell them I have class tonight, and I'm pretty sure some people even think I'm still a student here. So I still remember coming to my Accepted Students Day around this same time 3 years ago. I honestly remember thinking to myself, am I smart enough to be here? There were tons of projects posted around the room for when students did their practicums, and I remember reading it and getting excited, but I was also really scared. I remember putting stress on myself, thinking that I had to be perfect. BU is a top 10 school, so if you get into a top 10 school, that means you have to be perfect, right? At least that's what I told myself. A professor once jokingly told me, in undergrad, you leave thinking you know everything. After your master's, you realize you know nothing. And after your PhD, you realize that no one knows anything. So I guess it was right coming out of undergrad, thinking that I was supposed to know everything about public health before I even started. BU quickly showed me that I was wrong. I had never felt so welcome to a place as when I came here. I remember meeting with professors from the department. I talked to some current students to get their perspective, and everyone I spoke with was so passionate, even the admission staff that I had been chatting with over email. At the end of the Accepted Students Day, I realized that I was soon going to call Boston home for the next 2 years. Although I've only been a part of the BU community now for 3 years, they have already made so many changes to their program. They've recently switched to the cohort system, which Dr. Sullivan was talking about, and it gives you a little more time to pick your concentration or what area you're going to focus in. I think this is great. It's perfect if you know you want to do public health, but you haven't quite figured out where you fit into public health. It's also great for those who know exactly what they want to do because it forces you to get the well-rounded view of the discipline. I can honestly say there was not one class I took here that I felt like was a waste of my time. Every class I took contributed to making me the public health professional that I am today. The best thing about the classes here is that the teachers can take these theoretical concepts and apply them to your interest. Like, a teacher that can make statistics fun, I think that is a talent. I actually started off TAing with Dr. Sullivan. So they actually take the time out to tell you what this is used for, why is it important, and real life examples of it at work. If only my calculus teachers would have done that. I think it makes the classes super interesting and very applicable to the world. So a little bit about my background. I moved here from a small town in Arkansas, and coming to my Accepted Students Day here was my first time ever coming to Boston. Moving to a city like Boston was almost unheard of where I come from. I had never taken public transportation, and I had never dealt with more than 1 or 2 inches of snow at a time. One of the professors here joked with me every time he saw me in the hall or when a snowstorm was coming because he knew how terrified I was. Speaking of the professors, they had a big impact on my success at BU. They are all exceptionally smart, but they remain very personable and very down to earth. Unlike a lot of large universities, office hours are an actual thing here, and all the professors honestly, they honor the open door policy. They are so passionate about the subjects they teach, and they will inspire you to shoot for your dreams no matter how big or small they are. They are willing to answer any questions, literally no matter what. I feel like I was pushed beyond my limits that I set for myself, and I did things here that I never thought I would do. I never saw myself speaking at an Accepted Students Day, or being a peer tutor, a research assistant, a TA, or even a resident of Boston for that matter. The support I received at this university not only prepared me for a career in public health, but it has motivated me to one day pursue a PhD. I hope one day that I can teach public health to inspire people just as I was inspired here. So I was going to start off by saying one of my favorite things again, but you have to realize I have a lot of favorite things about BU. The networking opportunities here are really great. The faculty and staff seem to always serve food and center the events around lunch or dinner time. I guess you can say they know how to appeal to the broke college student. So with this, if you had an hour break in between your classes, you never had to choose between going to get lunch or going to a network event. It's like you could get both. It's perfect. When I was a student here, I had a lot of friends that I would say were from very different backgrounds. I felt like my thoughts and ideas were often challenged, and I was surrounded by diversity. I did not realize how great it would be once we all graduated and started working in the real world. There are people that I graduated from working all across different states as well as different countries. Every time I see a job posting on LinkedIn, I see the message, one BUSPH person connection here. Almost every job that I look at, every time I go on LinkedIn, I can literally find someone who went to BU that is working there. The network you gain here is amazing. BU is widely known across public health, and it makes it a lot easier when you start the job search. It's crazy to think before I came here, I knew absolutely nothing about public health, but now my life seems to embody it. I currently work for a division of the VA hospital called Maverick. I won't spell out the acronym, but mostly we do epi research studies directed at impacting the quality of life of veterans. I feel like BU definitely prepared me for my career, maybe even over-prepared me. I felt like I came into my job and I was looking for more. I was like, so do you want me to do this? Do you want me to do this? They're like, no, just start here, it's okay. I just felt like I was really prepared. I use the skills that I learned every day in my job that I got here. It is the greatest feeling in the world, seeing the time and money that you invest in education come to life. BU has given me so much to be thankful for. Besides a great education, I met some of my best friends here. I have formed relationships with professors that will last a lifetime. It is an honor to join them in this field and be able to contribute my own research. I've learned that perfection is not necessary to excel in this program, just passion, hard work, and dedication. I am so thankful that BU chose me, and I definitely hope that your journey will be as great as mine. Thank you.
Thank you, Rachel, and thank you, Jacoba. And I'd like to welcome our Associate Dean for Public Health Practice and Associate Professor of Community Health Sciences to talk to you a little bit about practice and activism, Harold Cox.
Hi, everybody. All right, so here's the most important question of the day. Who's here from Texas? Oh, thank goodness. I was worried there was going to be no one. Where are you from? Where are you from? Galveston? Dallas. Oh, okay. Well, I mean, that's good, too. I saw someone else. Yeah. Austin. That's good. I'm so sorry about the things that have been happening in your city just recently. But those are two incredibly wonderful places. The rest of you come from some good places also. But I'm glad that you are all here. So now here's the other important question. Who here wants to do something that's going to be, to make a positive impact in the world? Good. Okay. Who here wants to have a rewarding career? Good. Who here wants to be rich? Okay, well, I can't do too much about the last one. Sorry. But if you want to be and be in a place and have a career where you will have an opportunity to make a difference in the world, where you will get a chance to be challenged by very important and complicated questions and issues, then public health is indeed that area for you. Public health impacts every aspect of our lives. So as an example, when you wake up in the morning and you have that first breath of fresh air, there have been public health people who have been around monitoring the air quality. When you drink that first glass of water, there have been public health professionals who are ensuring that that water is going to be safe. When you go to your favorite restaurant, McDonald's, or wherever that happens to be in the morning for that Egg McMuffin, or for the vegans, whatever it is that y'all eat, you will know that there's been somebody from public health there to ensure that your food is going to be safe and good for you to eat. When you go to work, you can ensure that there have been people who have been concerned about making certain that everyone is going to be properly inoculated so that you won't come in contact, most likely, with some infectious diseases. When, at the end of the day, you go to the tattoo parlor, you can ensure that there was somebody there who was there to make certain that you are not going to come in contact with some blood-borne pathogens. Throughout the day and the weeks, there are individuals who are concerned with ensuring that you are going to know about getting rest and drinking water and exercising and using condoms and wearing seatbelts and many other kinds of things that are important for taking care of your health. And throughout the day and the years, there are individuals from public health who are on the front line thinking about issues around poverty and climate change and many other kinds of difficulties that we have in our world. So public health is indeed that discipline that can make a difference in your life. And if you want a place and a career that will make a difference, public health is that place for you. And then secondly, if you want to come to a place that is an exciting place to be, to study public health, that's Boston. Because Boston is a dynamic place. If there's a resource that you want, it's probably here. If there is an expert that you want about a particular topic, it's probably here. If you want to live in a place that is dynamic and where the parties are really good, it's Boston. It's right here. And then lastly, if you want to come to a place to learn about public health, and to be in a place where you're in the front line, where people are trying to make a difference and are constantly struggling to challenge themselves, then Boston University is that place. We are smart, we are active, we are dynamic, and most days we are fun. I promise. I promise. They promise. So Boston University is that place. Both Mike and Lisa have talked about our research and our education component, and the third piece of that three-legged stool is our practice. One of the components of our practice that we've just recently started is something that we call the Activist Lab. The Activist Lab is a vehicle for us to do real-world public health and to engage our community in real-world activism. So as a couple of examples, we have, during the summer, a number of our students last year there were about 60 or 65 people who went outside and were involved in passing out water every day between June and the end of September to the homeless population that's outside. But not only were they passing out water to the people outside, they were challenging themselves and thinking about some of the complications of the project, of the people who were there. Things like, should our students here actually know how to use Narcan for the people who they may come in contact with outside? What should we do about safe injection sites? Should we have one in our area? We also have about 9 or 10 students now who have gotten innovation grants, and these innovation grants allow them to do some firsthand kinds of things in the local community. We are very excited about those innovation grants, and students have gotten small amounts of dollars to do something that they consider to be something important in the community. We have a couple of students who we've identified as being our activist fellows, and one of those students is working on a very important initiative dealing with transgender equality and looking at overturning a very important ballot initiative that's going to happen in Massachusetts in November that will impact issues around equality issues for people who are transgender. And then today, we have about 25 or 30 students who are participating in the walk that many people are doing across the country in dealing with issues around gun violence. And while those people are there, we wanted to have you also have an opportunity to also give voice to issues around gun violence as well. So later today at the reception, you'll see this, and I'll tell you more about this a little bit later, but it's #enough. And it'll give you an opportunity to give voice about what you think we should be doing as well as we deal with issues around gun violence. So we are busy. There are many things that are going on in our school around education, around research, and around practice. Now, is Boston University the place for everybody? No, it's not, because that's why we didn't accept all the many thousands of people who apply here. However, we accepted you, and now we hope that you will accept us. So I hope that today, that you will spend the day learning about who we are. Spend the day understanding what the programs are that we have to offer, and make certain that you get everything answered that you need to get answered while you are here. And if there are still lingering questions, and I suspect there may be, make certain that you find one of us at the party this afternoon. And Rachel, you are right, there's food. We will have lots of that today and throughout the time that people are here. But make certain that you ask one of us those questions that are still lingering. We want to make certain that you know the things about us that you need to know in making this very important decision. As the dean said earlier today, whatever decision you make is going to be the right one. We hope that it's us. I'm so very glad that all of you are here, and I welcome you here. So we want to give you now an opportunity to think about an important issue and to have an experience of having a classroom experience with us and to get a sense of what the classroom experience is like here at our school. And we are going to divide you up in a few moments into smaller groups, and Jonathan will give you directions about that so that you can experience a classroom, but more importantly, so that you can talk about the issue around climate change. And the particular issue that we're going to be thinking about is, what is it that we ought to be doing differently? Given the last year of our hurricane season with Irma and with Maria and Harvey and other storm systems, we can expect with climate change to see more of those kinds of storms. And what is it that we should do in order to prepare ourselves for that? That's a very important question. And it's a question that you are going to be challenged with some of our teaching faculty who are going to guide you in that conversation. But before we do that, I want to invite Professor Jean Van Seventer to come up and to give a brief interview, a brief introduction about the topic. So a little bit about Jean. Jean is a veterinarian and is also a professor in the Environmental Health Department. I should never forget that. She's not from Texas, unfortunately, so if she were, I would know exactly what she did, but you know, she's not from Texas. But she's in environmental health, and with her particular interest in pathology and immunology, she has a particular interest in her teaching area in looking at the role of the environment in infectious disease and emergence and spread. Dr. Van Seventer is also the director of our infectious disease certificate program. She's a leader in the Superfund program here, and she's also a co-investigator with the Boston University Upward Bound Math and Science program. Jean. Oh, great. Hi. You can be from Texas, right?
I used to
Could you
live there. I lived there
You
for
lived
a
there?
short time.
Okay,
yeah.
that's good. That's good enough.
Okay, how do I forward this? Oh, okay. Hello, I'm Jean Van Seventer, and I am in the Department of Environmental Health, where I'm faculty. And what I am here to do today is to provide you with some background for a activity, case study activity over lunch, in which you will work together to formulate a public health preparedness plan which would be implemented in the event of a Harvey or Maria type hurricane strike on Boston with severe flooding and other destruction. Why are we having you do this? Well, it's not to torment you and keep you from having a relaxing time at lunch. We have several reasons, and we think that you'll find this case study both enlightening and fun. First, we want to give you a feel for what it's like to be in the classroom in the School of Public Health, where active learning is really a central pedagogical theme, meaning that the time spent in didactic teaching, where you sit and listen to your professor's lecture, is kept to a minimum, and rather the majority of class time that we try to focus on is about engaging with your professors and your fellow students to apply what you're learning in class, to address very important public health issues such as climate change, and to come up with solutions to the problems that are posed by these issues. Another reason we're having you do this case study is by walking you through the case. You will come to appreciate yourself how solving large and complex public health problems, such as those posed by climate change, requires the collaboration and the integrated expertise from a wide sphere of both public health professionals and professionals in areas of healthcare, as well as partnerships with stakeholders from many other sectors, including sectors such as law enforcement, government, private industry, and very importantly, the communities. This case will make evident to you the need for applying the skills that are taught in our functional certificates, such as epidemiology, biostatistics, and environmental hazard assessment. And it will also demonstrate the need to get input from individuals that have knowledge that comes from contextual certificates, such as maternal and child health, global health, and infectious disease. Lastly, climate change is a topic that some feel it's very timely because it's a topic that some people feel is the most important public health issue of this 21st century. And for this reason, it is a focus of many of us at BU, both teaching. I teach about climate change and its issues in all of my classes, and research, both in the School of Public Health and the wider BU community. For example, in our environmental health department, Patrick Kinney, who was the creator of this presentation that I'm giving you, he has been trying to take some of the climate change and health work he started developing while at Columbia University in New York and bring the program to BU to develop urban-scale solutions on climate change that will be good not just for cities and for the planet, but as well for human health. For example, by reducing emissions from cars, by increasing green space, and by providing more opportunities for physical activity for those who live in the city. So now, the background for this case that you're going to be doing. First, I'm going to review the connections between climate change and health for those of you who are not familiar with them, and then I'll give you a preview of what we'll be doing in the classrooms. We will be going into small groups in separate classrooms, and you'll have a facilitator who is a professor here working with you to walk you through the case. The issue of climate change, as I said, is thought by some to be the most important of this century. However, in the United States and a few other places, it is unfortunately still a very controversial issue, and there are a variety of reasons for that. One is it's complicated. The climate change is a complicated subject, the climate system is complex, and it has many drivers. Another issue is that for many, there seems a reason to ignore it because the issue of the impacts of climate change seem to be ones that are off in the future or affecting others, not affecting us. And of course, there are some who appear to have a vested interest in trying to confuse the subject of climate change and keep it a controversial issue. However, with the accumulated evidence from all the science on climate change, while complicated, it really can be distilled down into some basic realities, as it has been here for the 5 big facts, if none else. I hope you'll take this home. That was put together by the Yale Program on Climate Change Communication. And what these 5 big facts are, and we'll be taking a look at these, is that scientists agree on the issue. It's a real issue. It's an issue that was created by us. It's bad, very bad. But there's hope. And it's really work of individuals like Professor Kinney here and others at BU that is focused in large part on this hope part. So scientists agree. This is from a survey that was taken about 10 years ago showing 97 out of 100 climate experts agree. It's here, and we're the origins of global climate change. Again, there are some that still fall into the non-believers group, but this group tends to be those who have a vested interest in keeping the controversy alive. Then, it's real. So what you're seeing here is global temperature trends over a period of about 150 years. And scientists have done a very careful job of putting together temperature monitoring data from the late 1880s to present day. And what it shows is that controlling for things like urbanization and microvariation, since pre-industrial times, there has been a steady warming of global temperatures of about 1 degree Celsius. That's about 2 degrees Fahrenheit. So you say to yourself, 2 degrees, what's 2 degrees? How is that going to affect me? And I think, I've heard Dr. Kinney give this analogy, and I think it's a really great one. 2 degrees Fahrenheit. If you think about the average temperature of the Earth being an indicator of a very complex system, the Earth's complexity involves many different components. We have winds, we have atmosphere, we have oceans. Well, consider it like the human body. 2 degrees increase in temperature, you know something is systemically wrong. There's a lack of homeostasis, there's something going on, there's a disease there. And you can think of the Earth as the same way. That 2 degrees increase in temperature is something to worry about. It's an indicator of the negative effects of climate change. So if we look at this, we can see that the temperature has already increased by 1 degree Celsius. And at the end there, it's on a very sharp trajectory up, where we know it's going to increase by at least another half to a full degree Celsius. And if we are not to address the issue promptly, it's going to continue on that trend. So it's very concerning. 2016 was the hottest year on record. 2015, the year before, was the second hottest, and the 2017 was the third. So that does not bode well. Then it's us. Climate scientists have been able to develop climate system models to project future climate temperatures. They make assumptions about what society will do in terms of CO2 and other greenhouse gas emissions. What you see around the curves, the shady area, is the uncertainty from the different models. And while the models don't agree perfectly, what you can certainly see is that the data is pretty convincing in distinguishing between a smart growth scenario and that of business as usual. So smart growth scenario is that we attack this problem, we try control emissions, but even if we do that, we know that the temperatures are going to increase at least another half to full degree. And if we don't, and if we continue on the business as usual scenario, we're talking about by the end of the century, 2 to 4 degrees more increase in temperature and trajectory up beyond that. And you know, we've talked about just the 1 degree, what that can do. We're adding 3 and then more as we go on. So it's us, and it's bad. So I show you this, and you think, oh, increase in temperature, that's heat, so I should be thinking about drought. And yeah, it's obvious some of the things that will happen. We'll have more droughts because of the heat, we'll have sea level rising, but one of the most severe effects associated with climate change is centered about where water does or does not go, particularly with reference to agriculture and livestock. Some places are going to get wetter, some drier. And why were some going to get wetter? It's really the interesting paradox around precipitation and climate change, in that when you have a warmer climate, the warmer atmosphere is able to hold more water. So you have the vapor up there, and when it rains, a lot more will come out, and you'll get really severe rainfall. And on the other hand, in between times, you can have very long periods of drought. Both of these can have devastating effects on public health. So if you think about the health effect, if you think about the effects of climate change, I've been showing you some of the direct effects of climate change on our environment, and then there are indirect effects as well. Air quality, with increases in temperature, emissions, the pollution from emissions is worsened, and you will have effects, ecological changes because of flooding and so on. And both of these, both the direct and indirect effects, have huge effects on health. And I can just point out some of them. Some of them are very obvious, and you know about with temperature extremes. You have problems with heat stress. Of course, these things have happened before, but with climate change, the thing is that they're going to happen more frequently, and those temperatures are going to be even hotter than they were before. For some of the indirect effects, as it was mentioned, I have this interest in infectious disease. If we consider something like vector-borne disease, mosquito-borne diseases, malaria, Zika, and things, West Nile virus, well, the ecology of the mosquitoes changes. And you know, some things are obvious. The the range of these vectors will expand, so those diseases will expand in their range. But what you might not realize is that the competency of these vectors to transmit these diseases also increases. So in places where the diseases occurred before, they will now occur at a higher incidence and severity. We have indirect effects of climate change on water quantity, but also on water quality. And so the ecology of some pathogens, like the waterborne disease pathogens of cholera and cryptosporidium, at higher temperature, this promotes these waterborne diseases both in natural and in man-made water systems. As I said, the climate change can have indirect effects on air quality. That's a topic of intense study in my environmental health department. Air pollution, higher temperatures can make the emissions of some pollutants worse, and more smog has negative effects on both respiratory health, you can imagine that because you're breathing this stuff in, but also some of those pollutants pass and become systemic in the circulatory system, so they have effects on cardiovascular health as well. And an important thing to realize about all this is the straightforward stuff, but there are modifiers. There are modifiers due to the vulnerability of those who are affected. In general, climate change will, the effects of climate change on health are mediated or intensified by vulnerability factors such as age and gender. The heat stress is going to affect the very young and the very old particularly harshly. Social economic status, public health and public infrastructure, do you have things to help people when they get in trouble? And well, it might be obvious that these, when you consider these vulnerability factors, considering an industrialized country like we are compared to developing countries that don't have infrastructure. But today, what we're going to do is challenge you to consider how different populations and different neighborhoods within the city of Boston have different levels of resources and have some having fewer resources and have specific vulnerabilities that will make the effects of a hurricane strike here much more difficult for them. So how is health being affected? I didn't mention traumatic injury. When you have these severe weather events, that's always something. And I should also mention these things have huge effects on mental illness and people having to deal with these issues. Allergies. We know that warmer temperatures, higher CO2 levels. CO2 is a fertilizer for pollen allergy-producing plants, and so what we see is that the warmer temperatures bring the pollen season here earlier, it stays longer, and it's more intense. So it's bad, and if we take a look globally, and think about this vulnerability issue and the impacts, the WHO started about 15 years ago doing global health assessments of climate change, looking at how climate change is affecting and will affect things like diarrheal disease, malnutrition, malaria, and heat stress. And they did it on a country-by-country basis. And Jonathan Patz put together this cartogram showing the results of that survey. And what you can see is that the health effects are the greatest amongst those poorest and more developing nation, which is in complete opposite if you look at this, which looks at the cumulative greenhouse gas emissions in the last 10 years. It shows the US, Europe, parts of Asia are particularly responsible. So you have this incredible north-south inequity between those who created the climate problem and those who are affected by it. So how can we, there's hope, that was the last of those 5 points. How can we as a society respond to climate change? There are two main ways. One is mitigation. Mitigation refers to action to reduce emissions by cutting down on the emissions, and in some cases, actually pulling greenhouse gases out of the environment by planting trees. And adaptation recognizes climate change is here. It's happening, it's going to get worse, and we need to adjust to it. This is what you're going to be focusing on in your case study today. What we will try to do with adaptation is to reduce our vulnerability to what the expected climate change effects are going to be. We're going to be focusing on adaptation, but I just want to say a few words of mitigation, because that is a focus on what motivates a lot of the work that's being done here at BU with respect to climate change. In this case, if carbon-free strategies and low carbon emission strategies, they're going to improve air quality. That's obvious. They're going to increase access to green spaces. We're going to be planting trees. They will cause more environmental equity. The reason being, you can't just work on one area in Boston and expect that the effects are going to be localized to that. We have to work on all areas of Boston and across the globe. It's going to promote physical activities. We're not going to be driving cars. We're going to be biking more and walking more. Psychological well-being comes from all of this. Increase in social capital by doing these things. It will make us more resilient to climate extremes and the effects of things when we get the hurricane strike. There's going to be a reduction in noise, which adds to my physiological well-being, I know that, and access to healthy foods when we work on this subject. So meanwhile, we're back today, and climate is changing, and we need to prepare for it. So that brings us to today's case study. The setting is here. We're looking at being in Boston last October 2017, and we've watched the destruction in the wakes of Hurricanes Harvey and Maria. And your assignment is to develop strategies for impacts of major hurricane on public health and healthcare in Boston in the 2018 hurricane season, in case we get a strike like that. You're supposed to assume a worst-case scenario of the hurricane, which means the storm surge is coinciding with high tides and results in severe coastal flooding. And you are also being asked to recognize the disparate impacts of climate change, particularly the impacts on vulnerable communities. So if we look at here, this is Boston. Don't have a pointer, but you, I hope, can see there is Charles River coming through. We have the airport. We're down somewhere around here. And what we're looking at is, in the blue, it's the flood zone. This would be the flood zone by 2070 of the 1 in 100-year flood. And that's in blue, and in pink is one of those vulnerable communities, low-income communities. And what you need to consider today is that vulnerability is different, and that there's impacts where, especially where we are right here, where you have laying over that flood zone, that zone of vulnerable communities. This is not a new question. I've actually had meetings with a number shown here of representatives from Boston Healthcare, public health officials, where we've discussed what would we do, what are the concerns in terms of infectious diseases in Boston associated with climate change. But I just want to show you that Boston public health and healthcare infrastructure is strong. As you can see, we have the Public Health Commission with over 1,000 employees. We have EMS service. We have more hospitals here than, I mean, you can't walk down the block without hitting a hospital in Boston. But 20 licensed hospitals, 6 level 1 trauma centers, 12 acute care centers. We have many community health centers, and an expansive list of long-term home health, mental health clinics. This I just wanted to show you. This is Boston has something called the Medical Intelligence Service, so that when you have an emergency like severe flooding, it's mobilized during that emergency. This depicts the mobilization center. There it's down the street from us at the Boston Public Health Commission. And this is showing you photos taken after it was mobilized, just after the marathon bombing that occurred here. So what is your assignment? Public health preparedness for the storm. You're going to be divided into groups of about 18 or so individuals, and each of those 3 more groups. And each group is going to be asked to consider 3 preparedness focus areas. What do we have to worry about with this flooding in terms of toxic and biological exposures? What do we have to do to prepare for populations that might be displaced to evacuation shelters? And what do we have to think about in terms of addressing acute and chronic healthcare needs? Your assignment is going to be to consider each of these and the issues that they pose in each of these focus areas, and to also identify for each of these issues who are the vulnerable individuals. What is the population you have to really be concerned with that is targeted by these issues? After you've done that, we're going to then ask you to develop a preparedness strategy to address each issue, and then identify responsible parties who must carry out each of these strategies. And this is where you're going to see how it's not going to be an epidemiologist, an infectious disease doc, a physician who's going to, I mean, that's health, of course, they address health, but public health is about having many different sectors working together in a very coordinated way with their expertise to bring about the preparedness that we require. So I think it's a fun exercise. I know I enjoy going through it. We always get from students different ideas of what we need to be concerned with and how we'll prepare for that. And I'll see you in the class.
Thank you.